I'm Dr Ian Strawford. I'm the Medical Director of Skin Excellence Clinics, and I'm here today to talk about cryotherapy.
What is cryotherapy?
So cryotherapy is effectively a treatment where we are freezing the skin. It's using liquid nitrogen, and we can very instantly freeze the cells of the skin, and cryo stands for cold, and so it's a cold therapy, a freezing treatment therapy.
What can cryotherapy be used for?
So we can use cryotherapy for a number of lesions. It's traditionally been used for many years, and I've used it myself when I was a GP for treating viral warts. So effectively, verrucas or viral warts are very easily treated with cryotherapy, but it has other multiple uses really. We can use it to selectively treat other skin lesions like seborrheic warts or seborrheic keratoses. We use it a lot in clinic to treat areas of pigmentation. So these are what patients might call sunspots or brown spots of the skin, usually in later life, that appear due to prolonged and sun damage over the years. The medical term is solar lentigo, but these two are very effectively treated with cryotherapy.
How does cryotherapy work?
Cryotherapy works, as we said, by selectively freezing the skin. And certain cells within the skin or on the superficial layer of skin are more sensitive to that cold. So for example, with pigment cells in those sunspots, dark patches, it's the melanin cells, the melanocyte cells that are more sensitive to the cold. So they effectively are killed off by the treatment selectively. But the normal skin cells that produce the rest of the skin are left intact. They heal quite quickly and recover. So we're selectively killing cells. In the case of viral warts and verrucas, we're freezing the skin, and the virus that's living within the verruca or the wart is killed off because the virus is very susceptible to that freezing, to that cold. So we can selectively kill off the virus and allow the body to heal and remove the wart and verruca.
Is the treatment painful?
On the whole, cryotherapy isn't painful. It's more uncomfortable. Most patients tolerate the treatment very well without any need for a local anaesthetic, but with the solar pigmented lesions, we usually use a little bit of topical anaesthetic, and very occasionally, if we're treating deep seated verrucas or warts on the hand, we can inject a little bit of anaesthetic. But as I say, most people tolerate its mild discomfort in most cases. What
is the recovery period?
Usually, after cryotherapy, the skin can be quite red after the freezing has had an effect, and there can be some localized blistering to the treated skin, which can be easily covered with a simple dressing. Effectively, it's a cold burn, so to speak. But the recovery, usually, if there is some blistering, within a week or two, then there will have been a scab and there will be a recovery. The area of treatment can remain a little pink and red for a while, for a number of weeks after treatment, and you just have to be careful to not expose treated areas of skin to too much sun without any protection.
How many treatments are needed?
The number of treatments with cryotherapy depends on the condition we're treating. So if we're treating pigmented lesions or seborrheic keratoses on the face, then often one treatment is only needed. We may do a second treatment after 2 or 3 months if necessary. When we're treating warts and verrucas, then we usually need more than one treatment, maybe 2 or 3 or 4 treatments. Treating that area to try to kill off the virus are needed in most cases.